Good morning, one and all. Today we'll be talking about the hormones, the various hormones released in the body and its effect on the oral health. And as dental physicians, what are the points or the typical features we should look forward to when a patient's complains of a specific complaint and its relation to the general health and its hormonal status of that particular body. So what is basically a hormone? A hormone is any secretion which is basically released directly into the bloodstream. That is to say, in simple terms, it's a ductless kind of a gland wherein any secretions are released directly into the bloodstream and its effect is seen not locally but far away from the area of production. That means to say, when it produces or excretes, this gland excretes this particular secretions into the bloodstream, its effect is not only seen locally, but as a general proportion, general health of the body or the general effects of this particular hormone is seen overall rather than in that specific area. So this basically is derived from a Greek word which means I excite or arouse. So in relation or in response to any specific trigger or excitement or stimulus, these particular glands release out their secretions directly into the bloodstream to get a specific response. So basically in simple terms, it's a ductless kind of secretion. So among the various hormones which are released into the bloodstream, one of the most important or the primary kind of a gland or an endocrine gland is a pituitary gland, which is directly placed in the frontal, behind the frontal bone at the base of the cranial wall. So in this, obviously in any kind of a gland, irregularities in the production of the hormone is basically either on the higher side or on the lower side. Whenever it is higher, we apply the tag called hyper, and whenever it is on the lower side than the optimal levels, it is called hypo. So similarly, here we have the hyperpituitarism, which is one condition. Then basically it is because of the hyperfunction of this pituitary gland or any tumors or enlarging kind of tumors affecting the pituitary gland. So in this we have basically hyperpituitarism, which affects people in the young age as well as in the old age. Now in the young age, since it is in the growing stage, the overall proportions of all the human parts or the human body parts are increased to a bigger than normal size, which is referred to as gigantism. Now in the older patients wherein the growth has already stopped, therein we find the condition called acromegaly. So as I told, the clinical features of gigantism, the overall structure of the body, all the parts are bigger than normal. As you can see, the normal person as well as a person affected with hyperpituitarism in his young age. So that gives an overall overgrowth of all the bony as well as the soft tissues. Now, acromegaly, on the other hand, can be wherein the growth of this particular person is predominantly seen wherein the development or growth is still ongoing, which is an ongoing process, or it is also seen wherein continuous modification or remodification of the bone and the soft tissues are seen, especially your joints. As you can see, the hands of an acromegalic patient and a normal patient placed side by side. You can see the mandible, which is continuously in a remodification state, and its counterpart, your teeth, which are most important for us. You can see a protruded mandible when compared to the maxilla. So overall, there is an increase of the growth hormone, high blood levels of the growth hormone, predominantly released by the anterior pituitary gland. In the teeth, which is more important for us, you can see the enlarged kind of jaws. Now, teeth on its own, since in the childhood it was not affected by hyperpituitarism, the teeth size remains small, but since the jaw is much more bigger, we find a relative hypodontism or smaller teeth, relatively speaking, wherein actually the teeth are not small. This condition is called relative microdontia. And you can also see, because of the large jaw size, we can also see the various gaps, multiple gaps or diastemas in between the teeth. Now the management, it is simple. Either you give a antagonist which can react against the growth hormone, which can reduce the blood levels of the growth hormone, or for a more permanent cure, we can always opt for surgery or radiotherapy. Now, on the other hand, as I said, hypopituitarism, wherein there is lower amount of lesser than optimal level of production of growth hormones or presence of growth hormone levels within the bloodstream. Now, this again, the etiologies may be any destructive lesions or a space occupying lesions or tumors within the pituitary gland foci. Now, as compared to the gigantism, what we find in this particular condition is called pituitary dwarfism. That means to say all the body parts are smaller than normal, than the optimal size, as you can see over here. The overall stature, the structure of the particular person is much more smaller than the normal counterparts. Now, the clinical features, as I said, short stature, hypocalcemia, everything on the lower side, diabetes insipidus, lower amount of productions of hormones from the pituitary gland, which gives rise to diabetes insipidus. Now, oral manifestations, the jaw size is small, the teeth are normal in size, but there is delayed eruption or a bigger relative macrodontia when compared to the jaw size. Now, all these characters, the bony structures itself, overall bony structures are much more smaller than the optimal size. The teeth, when it comes to teeth, obviously since everything is on the lower side, the development is on the lower side, on the slower side, there's complete absence of root buds at few points of time in few cases, or there's complete absence of the third molars altogether, or when in general the developmental stages through which the teeth go through, the development stages are they are stop at a much earlier stage. That means to say the roots or the apices, the closure of apices, which is almost the last stage of a tooth development, that is not seen in these kind of patients. So that their teeth are very short, the apices are wide and open. So there is also loss of alveolar bone, again because of the lack of development of the particular jawbone. Now, similar to the treatment of hyperpituitarism, we can also give a replacement of an agonist of growth hormone or growth hormone replacements within the body, or directly any primary cause which has caused this reduction in growth hormone, that can be removed, like any space occupying lesions or tumors. The other hormonal endocrine gland of importance is the thyroid gland. Again, here we find the hyperthyroidism and hypothyroidism. The thyroid gland, as you all know, it is directly, the hormone release is directly proportional to the metabolism which takes place within the body. So in hypothyroidism, basically the metabolism is on the higher side. So there is the BMR, the basal metabolic rate of the particular body is on the higher side. So all the metabolisms or the heat generated by the metabolic hyperfunction in the body gives us to its specific clinical features like intolerance to heat, because already there is a great amount of heat which is produced because of elevated metabolic rate. So that the etiology could be toxic adenoma or a pituitary disease. Again, which anything which causes an enlargement of the thyroid gland. So the basic hormone which is responsible or which is released by the thyroid gland is the thyroxin, and which again gives rise to the various clinical features, as you can see over here. The most obvious is a exophthalmic goiter because of deposition of a retrobulbar fat behind the eyeballs or within the eyeball space. The eyeballs are protruding out of their sockets, which gives rise to this typical feature, which is called exophthalmic goiter. Now, the clinical features which we see are all a direct result of the increased amount of metabolism. You can find an enlarged thyroid basically because of increased amount of production of thyroxin. Now, intolerance to heat because of increased BMR. You find straight hair, again because of lack of nutrition to these organs or keratin, dead organs. Your hair, which is made up of your dead keratin. So basically, the metabolism is on such a higher side that the normal functioning of the body is disturbed. So whatever may be the features, your bone wasting or muscle wasting, your lack of bone turnover, your muscle atrophies, all these are because of the direct result of increased amount of thyroxin within the bloodstream. Now, when we come to the oral manifestations, as I said, the metabolic rate is on the higher side. Since nutrition is on the higher side, your development of the teeth or jaw bones are on the higher side. So you can see advanced rate of dental development. Now, because of the faster rate of development, we can also see premature dwindling or falling away of the deciduous teeth and premature eruption of the permanent teeth, basically because the metabolism is in a hyper function mode. Now, alveolar bone, as a result, there is generalized decrease in the bone density as such. Now, the radiographic features, because of the increased metabolism, there is increased absorption of calcium or minerals from the bone. So there we can see generalized osteoporosis, a decrease in the density, that is the decrease in the bone density, and also alveolar resorption. Now again, the management, antagonist to the thyroid drug, thyroxin, that is anti-thyroid drugs, or in cases wherein we see absolute increase in the thyroid gland or hypertrophy of the thyroid gland, we can go for radioactive iodine, which can reduce the size of the thyroid gland, or we can go for surgical modalities where total or partial thyroidectomy. Now, on the other hand, there is also decrease in the thyroid production, thyroid hormone production, that is a hypothyroidism. Now, all the clinical features are reversed in this kind of disease. We can see the hair loss, the bulging eyes, your poor hearing, all developmental activities are very much slowed, very much behind the schedule. So everything lags behind. The developmental aspects are lagging behind. So in comparison to hyperthyroidism, your hypothyroidism, when we come to the oral manifestations, there is actually delayed fallout or a delayed exfoliation of the deciduous teeth. As a direct result, there is also delayed eruption of the permanent teeth also. So these are all the oral manifestations on the other side. We can see because of shorter stature, shorter development of the bones or the muscles, everything is on the lower side. So that basically is basically are the clinical features of hypothyroidism. Now the management, obviously, since thyroxin is underproduced, what we have to do is give a replacement drug. Most commonly used is a levothyroxine, which increases the level of thyroxine within the bloodstream, which is available in various dosages, 25, 50 and 100 micrograms. Now the basic protocol which is followed is basically we start with a dosage of 50 micrograms per day, and gradually within a span of 3 weeks it increases to 150 micrograms per day. Now, lowering the body temperature and hospitalization if severe, if the conditions still persist, or if the dosage of the replacement drug which we give is on the lower side, then hospitalization is necessary. Now, the next important gland close in near proximity to the thyroid gland is your parathyroid glands. Now, again, here we have hyperparathyroidism and also hypoparathyroidism. Now, basically, what the hormone which is released by this gland, that is a parathormone, it basically increases the level of calcium within the body. Now, so increased blood calcium is a one and only function of parathyroid gland. Now, how it derives its calcium are from the various bony structures, your alveolar bone within the jaws, various bones. Now, these give rise to the secondary signs and symptoms of this hyperparathyroidism. Now, as you can see over here, now the skull bones get decalcified. You find lesser amount of density of the bones within the skulls your general bones of the body itself. Now, because of the continuous resorption which takes place, because there has to be increased calcium levels within the blood. Now, this continuously demineralizes the bone, so we find a generalized decrease in the bone density. There is generalized osteoporosis, especially of the long bones. So we find this generalized osteoporosis which is seen. Now, where does this all elevated calcium go? So obviously the body doesn't need, or the parathormone, which, or in other words, the parathormone doesn't allow the body to uptake or reuptake this calcium levels within the body. So this all calcium goes into goes as calcifications within the renal, as renal stones, or we can see herein we can see the muscular atrophy and subsequent things. So all this extra calcium, since it cannot be, the kidneys are overworked in this particular condition. There is nephrocalcinosis, there is deposition of calcium within the kidneys, thereby again decreasing the function or damaging the kidneys, thereby giving rise to its secondary typical features of hyperparathyroidism. There's also metastatic calcification, again primarily because of increased calcium levels within the body. Now, on the other hand, the oral manifestations, because again there's increased amount of calcium within the body, there is a metastatic calcifications in the form of pulp stones within the tooth root canals. There is also, because of the generalized destruction of the bony areas, the generalized osteoporosis, what we find here typically is your Brown's tumor. That means to say specific areas or generalized areas, well-defined areas of bone loss or bone resorption, which is then replaced with nothing but a granulation tissue, or blood vessels and nerve tissues bundles, which gives rise to, on histopathology, we find brown areas within the bone, which is nothing but specific areas of decalcification within the body. This is seen as well-defined radiolucencies within the jaw bones. On taking an OPG or a skull radius, we find this structure. Now, because there is a loss of bony areas or bony support, or the alveolar bone support for the teeth lose the support, they start drifting. There's a severe malocclusion in these kind of cases. So all this because of lack of bony support, and because of parathormone, which resorbs this bone to increase the calcium levels. And the management, obviously, surgical option is always open. There's always the hyperplastic or hypertrophied tissues of the parathyroid glands can be removed, or there can be vitamin D supplements, which again tries to reuptake this calcium into the bones. There's also few precautions which have to be taken. Restriction of dietary phosphate. Now, because this phosphate binding agent administration should be done, because since the kidneys are already overworked over here, and also already the calcium phosphate ratio is reversed in this kind of a disease, hyperparathyroidism. So dietary phosphate has to be reduced totally, so that the calcium phosphate ratio can be again brought back to its optimal levels. So on the other hand, we also have hypoparathyroidism. Now, there is decreased calcium levels within the bony bloodstream because of a lower amount of parathormone. Now, what that results in is your process sign of chopsticks, and basically because of lesser nerve excitement. Now, as you all know, for nerve impulses to travel, the most important mineral which is needed is your calcium ions. So since calcium ions are on the lower side, your calcium level is on the lower side, your process sign, which is basically, or chopsticks, and basically it demonstrates the lack of calcium levels within the blood. So that can be seen as a typical clinical features, or overall hypocalcemia within the reduced calcium levels within the blood can be seen over here. So what are the oral manifestations? One is the chopstick sign, the tapping of the mandibular angle of the mandible, there is a sudden increase or opening of the jerking of the mandible, primarily because your mandibular nerve is hyperexcited in this case because of reduced calcium levels. There is also teeth, as you can see, because there is reduced calcium levels. There is hypomineralization of the enamel. So we can also find delayed eruption, primarily because there is a lack of calcium for the development of the tooth. So external root resorption and root dilatation, primarily all because there is a dysfunction of the during the developmental stages of the tooth and the tooth buds because of lack of calcium. So the management, obviously, since the calcium is on the lower side in the bloodstream, we have to replace it externally by calcium or vitamin D supplements or intravenous calcium gluconate if the symptoms are on the severe side. Next, we have the diseases of the adrenal gland. Now, one of the by far the most important endocrine gland within the human body. Now, Addison's disease is nothing but reduced production of adrenal gland hormones. So there is chronic adrenal insufficiency from the adrenal cortex. Now, basically the etiology could be anything, starting from trauma or autoimmune or infections or any drugs which have an adverse effect onto the adrenal glands. Oral manifestations as such, there are a lot of general manifestations of Addison's disease, but from the oral manifestation point of view, the most important is the bronze pigmentation. Now, a few patients might complain of increased pigmentation, a bronzy kind of pigmentation of the oral mucosa, a generalized pigmentation which was not present since birth, but it has recently developed. So the first and foremost investigation which we have to do is to find out the levels of adrenal hormones within the blood. So that would give an immediate indication as to the underlying disorder which is resulting in this kind of pigmentation, and hence subsequent steps can be taken. So the management, obviously, glucocorticoids, because they're generally produced in adrenal Addison's disease, and also supplement the mineral corticoids. Now, on the other hand, when there is hyperfunction of the adrenal gland, there is excess amount of production of glucocorticoids or mineralocorticoids. Now, glucocorticoids is one of the most important hormones, the corticoids hormone of the adrenal gland. There's increase in its levels will give rise to something called as Cushing's syndrome. Now, the Cushing syndrome is very typical. They have very typical features like increased amount of fat deposition, giving rise to something called as buffalo hump. That is nothing but excessive fat which is stored at one particular place. So that gives rise to this buffalo hump features. Now, that also because of the deposition of fat in the fat within the dermal tissues. Now we have a typical moon kind of face, that is nothing but your buccal pad of fat there's increased amount of fat deposition within the soft tissues of the oral musculatures. So that gives us to a moon kind of shape. So the most important features, the one is the moon face and the other is a buffalo hump, which are the typical features of Cushing syndrome. Now, glucocorticoids, as you all know, it plays a vast role in the various metabolisms of vitamins, your proteins, or carbohydrates. So all these carbohydrate metabolism, the lipid metabolism, all these do not function properly in the absence or function they are overworked in the presence of excessive glucocorticoids. So that gives rise to the various typical features which you can see. Now, from the oral point of view, there is increased chances of diabetes mellitus, increased sugar levels. There are also increased chances of hypertension. So, any oral extraction procedures, when a dental physician comes across such kind of Cushing's disease patient, we need to advise for their regular BP monitoring is very much needed. So, in these kind of patients who are affected by Cushing's disease, your oral manifestations, the primary thing which we have to take care about is the hypertension or the BP monitoring of the patient, because these patients are more prone to hypertension, as well as the sugar levels, because these patients again are prone to increased sugar levels. So both of them have to be regularly monitored in cases of any oral invasive or surgical procedures which would be dealt by the dental physician. These monitoring, these factors or parameters monitoring are of utmost importance. So the oral manifestations, as I said, because glucocorticoids are very much needed for the proper functioning of the body. Now in this, the children's growth, they might be retarded, mentally retarded, or in this children, growth is on the slower side. So all the modifications which are needed to interact or do any dental treatments in mentally retarded patients, that all have to be utilized or they come into play in dealing with patients with Cushing's syndrome. So again, this management, as I said, the permanent options, your surgery and your radiotherapy, or temporary relief by giving drugs which can counteract these effects. The drug which is most commonly used is metropone, which is given at 2 to 6 grams per day. The other most important, or the last last most important endocrine gland is your pancreatic gland. As you all know, the most important disease associated with it is diabetes mellitus. Now, diabetes mellitus, as you know, is basically because of a lack of insulin production, which is basically the hormone which is released from a pancreatic gland. Now, there are two types in it. One is insulin dependent and one is insulin non-dependent, type 1 or type 2. It is basically most common cause would be the autoimmune or hereditary factors play a big role in development of diabetes mellitus. Now, diabetes mellitus, as you all know, because of the increased sugar levels, there is a lot many oral manifestations or oral complications which come into play in patients with diabetes mellitus. Basically, if you see the general features, you have polydipsia, polyphagia, and polyuria, the three most important features of diabetes mellitus, along with Kussmaul's breathing or acetone breath, basically because of increased sugar levels within the bloodstream. So, as I said, the type 1 diabetes mellitus basically is autoimmune or because of stress or diet or some viruses. The type 2 is mostly genetic or sometimes maybe environmental factors like changing lifestyle, the Western kind of lifestyle. All these are results in type 2 kind of diabetes mellitus. The most important features, though, are seen are the oral manifestations, which are most important to the dental physician. Now, effect on the periodontium is one of the most important thing. Now, the diabetes increased sugar levels obviously, first of all, decreases the healing ability of the soft tissues. So, any surgical procedures which have to be done after taking into account the blood levels. Now, blood levels have to be maintained if there is to be a proper healing after extraction. Else, it might go into dry socket kind of scenarios. So, basically, because the healing is not proper. Now, there is xerostomia, which is associated with diabetes mellitus. Obviously, because of all the sequelae, because of reduced salivary production come into play in diabetes mellitus patients, primary being your opportunistic infections like candidiasis. So oral candidiasis is one of the most, the first kind of opportunistic infection which is seen in uncontrolled diabetes oral mucosa. Now again, because the periodontium again is much weakened, the gums are very much prone to periodontal diseases because of again increased amount of sugar levels. So in these patients, maintenance of oral hygiene should be of a primary, very strict and primary importance. So as I said, all the other features which are associated with reduced sugar levels or reduced salivary levels, that all come into play in a diabetes mellitus patients. You have burning mouth, primarily because of xerostomia or dryness of the mouth. So all these are seen in diabetes mellitus patients. So whereas coming to radiographic features, you have obviously we see a destruction of the lamina dura, the loss of periodontal support, a rapid decrease in the alveolar bone heights, so blurring of the alveolar cluster. All these are basically because of increased amount of incidence of periodontal diseases because of lack of subsequent healing by the body. So there is a gradual destruction of the bony structures, of the gum structures, increased incidence of gum infections, gingivitis or periodontitis, and then that progresses into the bony level and causes destruction of the supporting bone. So management, obviously we can always go for diet control in the initial stages, or the next stage would be your oral hypoglycemic drugs, or in the final stages we can go for insulin injections. So that would be the various hormones in the endocrine glands and the effects on the oral hygiene or the oral features of these endocrine disturbances, and how a dental physician should be able to put always these scenarios at the back of the mind before treating or looking into the oral mucosa. And if he comes across any particular typical feature, he should primarily deal with the primary cause, refer to a general dentist, get those conditions under control, and then go for further oral treatments, so as to the treatment prognosis would be 100%. Thank you.